Hi, everyone. Welcome. We're going to give people a minute to log on before we begin this morning session. So I'll give it just one more minute and then we'll dive right in. Thank you for your patience. Okay. Good morning or good afternoon, depending on where you are. Welcome to today's Research America's Alliance discussion. I'm Ashley Arbasati, and I'd like to thank you for joining on Zoom today and for your partnership in the Research America Alliance. If your organization isn't a member, we invite you to stay as our guest, but please do get in touch with my colleague Joel. He's happy to connect with you to discuss the value that comes with being an Alliance member organization. You can find his email in the chat if one of my colleagues doesn't mind dropping it in there. Today, I am so pleased to be joined by Dr. Neil Vora, a physician with Conservation International, to discuss his work in addressing pandemic prevention. His work focuses on the link between human health and the health of the planet, particularly as it relates to the increasing threat of viruses that can spill over from animals to humans, and how policy can be used to prevent future pandemics. As always, please type your questions into the Q&A box or chat, and we'll pose as many as we can during the Q&A portion of today's session. Thank you so much, Neil. I'm so pleased to have you joining us. Neil is a long-term colleague of mine, and we bonded during the pandemic. So I'm going to turn it over to you for your presentation, and then we'll come back and have a discussion.
Thank you, Ashley, and Research America, and everyone attending today. I'm so excited to be here. I'm going to share my screen, so give me a moment, please. Okay. Ashley, can you give me a thumbs up if you can see the slides? All right, perfect. Thank you. All right, it is absolute pleasure to be here. Excited to present on this topic of primary prevention of pandemics. I want to start by acknowledging that the work that the content that I'm presenting is not original content. A lot of other experts and people in the field have been talking about these issues for a number of decades, and clearly they've come to a head over the last 3 years. A disclaimer that the views that I'm presenting are mine, though not necessarily that of my employer, and I have no financial conflicts of interest to disclose. Some basic definitions. And the other point I want to make when I go through these definitions is that I'm proposing some loose definitions for these terms. If you ask the next person, they might give you a slightly different definition. And so there is some flexibility here, but the definitions I propose here are sufficient for the purposes of this presentation. So a pathogen is an organism that causes disease. A zoonosis is a disease caused by a human pathogen with a non-human animal source. Emerging infectious diseases are infectious diseases whose incidence in humans has increased or threatens to increase in the near future. And pathogen spillover is the transmission of pathogens between animals and people. Sometimes people refer to spillover in just one direction, from animals into people. Sometimes it refers to both directions, from animals into people and from people back into animals. So again, just keep that in mind as we move forward. So what you see here is a paper published in Nature in 2008, and I was a med student when this paper came out. I was taking a year off doing research in Uganda on HIV and malaria, and my undergraduate research mentor, who is a marine biologist, emailed me this paper thinking that I would find it interesting, and indeed I did. In fact, it changed the course of my career because a light bulb went off in my head. I knew deep down, in my gut, that what was happening to nature was having an impact on human health, but I did not know exactly how. And even when I would talk to many of my medical school professors and ask them about that connection and tell them that I was interested in that intersection between the destruction of nature and human health, many of them, quite frankly, would give me a puzzled look and would think that I'm in the wrong field. But this paper showed me a different path forward. Basically, it looked at how emerging infectious diseases have changed over time. And this figure right here from the paper is one of the main takeaways from the paper. On the x-axis, you see the decade. The y-axis shows the number of emerging infectious disease events. And the paper showed, the data from the paper showed that emerging infectious disease events have increasingly occurred over the last number of decades, even when controlling for reporting bias, and that most emerging infectious diseases originate in animals and then jump into people, that they're zoonotic. And when you look at zoonotic diseases, most zoonotic diseases have wildlife sources. And for me, that was the light bulb. That I finally understood that what we are doing to nature is having an impact on our own health because we are bringing many of these outbreaks that we are experiencing upon ourselves. And when you think about zoonotic diseases, the list of zoonotic diseases that impact us are often, are quite frequently, can be high consequence. Everything from anthrax to rabies, SARS back in 2003, Mpox, formerly known as monkeypox, and other pox virus infections, Ebola, Zika, HIV, novel flu, and also very likely COVID. If you look at just 1918 through 2009, we've had 5 viral pandemics. 4 of them were flu pandemics, and then we had an HIV pandemic, and all 5 of those pandemics also had animal origins. And so clearly, these are very important diseases that impact humans in significant ways. If you think about the drivers of spillover, and I'm talking about that the jump of a pathogen from an animal into people, it's actually a complicated process. It's not as simple as putting a human in close proximity to an animal, that there are more steps in between. And I'm not referring here to once a pathogen is in human, the factors that might impact how transmissible that pathogen is among humans, but I'm really just focusing on the jumping of a pathogen from animals into people. There are a number of major drivers that are behind why we are seeing more spillovers around the world. Number one is land use change, particularly in the form of deforestation and forest degradation. Number two is the commercial wildlife trade pipeline, and I'm referring to both legal and illegal wildlife trade. Number three is poor biosecurity or infection control when raising farmed animals. And number four is climate change. New research has shown that climate change is pushing reservoirs of disease, such as bats and rodents, in closer proximity to people as these animals seek out more favorable living conditions. So let's do a deep dive into one of those specific drivers, deforestation and infectious disease emergence. How does deforestation drive pathogen emergence? Well, there's at least 4 different mechanisms. Number one is that when we deforest, we are creating a forest edge that increases opportunities for humans and domestic animals to come into contact with each other. You can see that in this picture right here, right? You see that there's a very clear demarcation between forested areas and the deforested area, but there are wildlife that survive that deforestation, which leads to the second reason why deforestation drives in infectious disease. That is that when we are clearing forests, we are destroying the homes of these animals. And just like in humans, when we are stressed, we're more likely to get sick. The same thing for animals. They are more likely to become infected and then shed pathogen, which can then infect humans. Number three is the loss of biodiversity. So biodiversity is a term that refers to the variety of life on Earth. And when we have deforestation, we are driving loss of biodiversity. Rainforests, tropical forests are among the most biodiverse ecosystems on the planet. And what research has shown is that the species that tend to survive deforestation, these are species that can often live alongside people, as opposed to other species that might go extinct or disappear first. These are species that are more narrowly evolved to only live in a forest environment. But it also is the case that those species that survive, those that can live alongside humans, for whatever the reason, are also capable of harboring pathogens that can then infect people. And reason number four is that deforestation contributes to climate change. Nature-based solutions such as rainforests are a major way that we can mitigate and adapt to climate change. But when we lose those forests, we are worsening climate change, and then climate change itself is an independent driver of spillover and infectious disease threats. So if there's one takeaway to take from this this conversation today, is that human activities are driving the accelerating pace of pathogen spillover. We are, in many ways, because of our own activities, responsible for bringing upon these outbreaks that we are increasingly experiencing. Now, there's very little good that's come out of the last 3 years with the COVID experience, but at least now we have seen the development of a new global movement to reduce morbidity and mortality from pandemics. Experts, such as some of you on this call, perhaps, have been calling for more investment in pandemic prevention, preparedness, and response for decades. Well, we're now seeing, even at the highest levels of government, more interest in such investments. And Mpox, which has emerged over the last year as a major epidemic, only underscores the ongoing threat. So we're seeing these conversations take place, and addressing pandemics will require very robust investment in prevention and preparedness. So when I say prevention, that is about avoiding a pandemic in the first place or reducing the threat. When I refer to pandemic preparedness, that's about increasing the ability to respond if a pandemic occurs. So that's reducing our vulnerability. If we underinvest in either of these domains, we will fail to lower the risk of another pandemic occurring or mismanage the next pandemic when it occurs. So while I said that we are now having more conversations about investing in pandemic tools, my concern is that many of these discussions just focus on preparedness, but not as much on the prevention side. So there's a lot of conversation about how do we get ourselves more ready for the next pandemic, but not about preventing those pandemics in the first place. So let's dive a little bit deeper into why I'm saying this. Here's a screenshot of a pandemic plan that the Biden administration released in September of 2021. And what you can see is on page 7 of this report, they say that new infectious diseases have emerged at a quickening pace due to increased zoonotic transmission from animals driven by population growth, climate change, habitat loss, and human behavior. Right? So in the introduction, they acknowledge that what humans are doing is driving the pace of pathogen emergence. But then when they go on to list goals around addressing pandemics going forward for the US government, paradoxically, there are no goals to address spillover, even though they do have a goal to address laboratory accidents. Now, let me be very clear. Addressing laboratory accidents or even intentional releases from laboratories of pathogens is absolutely important. We need to be investing in that. But if you look at the 6 pandemics over the past 105 years, 5 of them certainly were the result of spillover of pathogens from animals into people. The 6th one, COVID, very likely was also the result of spillover as well. And so we are often, again, missing major opportunities to address the upstream risk factors that are going to only have very severe consequences for human health going forward. And not just human health. Clearly, pandemics are an all of society problem. Now, I'm glad to say that there has been a change over the last 2.5 years, over the time that I've been very closely tracking this. For example, more recent policy from the Biden administration released last year reflects a shift in their stance. They now are acknowledging more about the importance of preventing spillover, as you can see in the link at the bottom of this slide in the new National Biodefense Strategy. And I'd like to think that advocacy from civil society and academics over the last 2 years has played a very important role in that shift. And I think some of you have been very involved in that advocacy, such as Ashley and Peter Paul on this call. And that type of advocacy is so important. So let's dive a little bit deeper into pandemic prevention, because I've actually been using this big bucket term, but you can break it down into finer components, into primary and secondary prevention. So let's start with actually secondary prevention. Secondary prevention is about containing the spread of a pathogen after an outbreak has already occurred to avoid an epidemic or a pandemic from occurring. Quite often, even though prevention is not explicitly mentioned in these policy discussions, decision makers are implicitly talking about secondary prevention. And that's because many of the actions for secondary prevention and pandemic preparedness are closely related. But what they're not talking about is primary prevention. And that's about avoiding outbreaks altogether through reducing risk of pathogen spillover, improving laboratory safety, and addressing biological weapons. Based on historical precedent, as I was saying before, and the ongoing pace of environmental degradation, spillover is the most likely cause of the next pandemic, meaning that reducing the risk of spillover must be a priority for public health. Why are just investing in secondary prevention and preparedness insufficient if we want to address the threat of pandemics holistically? Well, first of all, there's an inequitable distribution of the tools of preparedness. All too often, Vaccines, medicines, even information do not make it into the hands of the people who need it most. We saw that with COVID. We've seen that with Mpox, where it's been hard to get vaccines into the arms of people who are most susceptible to infection or who are at highest risk for complications. Second of all, emerging infectious diseases often defy conventional wisdom. We've seen that in the last decade alone with Ebola, Zika, COVID, Mpox. We have a very limited understanding of infectious diseases until outbreaks, epidemics, and pandemics occur. And when these pathogens spread at very high levels, we start to learn new and often horrific things about these pathogens. Number three is spillback. When we just focus on containing spread in humans, we don't address the fact that we can then pass pathogens back into the animals. That's spillback. And when those pathogens then start circulating in animals and then spill over again into humans, there are opportunities for them to pick up new mutations and change genetically that then adds to their virulence that can have, again, worsening impacts on humans. Number four, we live in an age of disinformation and rising populism. We have seen how internet has led to the spread of disinformation and misinformation that lead people to make choices that are not in their best interest. And finally, many experts would argue that we are actually less prepared today in 2023 than we were in 2019 for the next pandemic for a variety of reasons, including distrust in public health systems, distrust in elected officials, and also the fact that our healthcare workers, who are the heroes of the pandemic, are fatigued. Right? I have so many healthcare worker colleagues, including many of you on this call, I'm sure, who are exhausted. And if the next pandemic were to strike tomorrow, I am deeply fearful of the well-being of our healthcare workers who have borne so much of the burden over the last 3 years. So what can we do to actually reduce the risk of spillover? Well, listed on the slide are some of the interventions. Number one is stopping deforestation and forest degradation in heavily forested tropical areas. We need to enhance the health and economic security of communities living in areas of high deforestation. Number three is that we need to strictly regulate wildlife trade in markets involving species that pose a high risk for public health, particularly live birds and mammals. And number four is that we need to improve infection control when raising farmed animals. The costs and benefits of preventing spillover through interventions such as that I just mentioned the costs are actually quite minimal compared to the cost of dealing with the pandemic. When we had the occurrence of COVID from 2020 onwards, we have lost millions of lives, most importantly, and trillions of dollars of economic output. However, scientific research has shown that actions to prevent spillover in the first place would just cost $20 to $30 billion a year. That is a drop in the bucket compared to the cost of responding to a pandemic. So now moving towards the closing of this presentation, many people would argue, or many experts would argue, that we are in the midst of a new geologic epoch called the Anthropocene, where humans are now the dominant force shaping the planet's biophysical conditions. And our impacts on Earth's natural systems are only intensifying exponentially. And so there's a paradox where human activities and our extraction of resources from nature have led to great improvements in access to energy, in food production, in less poverty, in better health. But now we are at this inflection point where the state of human health and that of the planet's natural systems are actually now trending in opposite directions. As one person has said before, we have been mortgaging the health of future generations to realize economic and development gains in the present. And today I have just focused on viral diseases, but beyond viruses, there are many other infectious threats that are going to get worse because of what we are doing to nature. For example, fungal diseases, and beyond that. But we are also seeing impacts from what we're doing in nature on nutrition, on non-communicable diseases, on mental health, and on displacement of people and conflict. Is nature in a bad place right now? Yes, but I also want to reject the delusion that we have lost. We have not yet lost. Now that I work in the conservation space full time, I see how much amazing work conservationists, ecologists, and many others are doing around the world. And I look at the younger generation behind us, that is doing so, behind me, I should say, that is doing so much to advance nature-based solutions and conservation of nature. So what happens from here is our choice. I know many of you on this call are health researchers, so I just want to make a plug for what you all can do as health researchers. First of all, we have to be bold and expand our vision for what is needed for a healthy future. We need to employ a One Health and equity-focused approach. One Health being the idea that human health is related to the health of the planet and animals. So we have to investigate the degradation of the global environment and its human health effects. We need to support future generations of interdisciplinary researchers. We have to build partnerships. We have to broaden research, policy, and programmatic structures beyond those focused on narrow disciplines. We need to stay informed, join coalitions, engage in the policymaking process, and inform elected officials, make research endeavors more sustainable. We have to counter the rampant spread of misinformation and disinformation, communicate clearly and effectively, which I hope I've been doing today, but I'd love feedback. We have to translate science into action, and we have to educate our study subjects enrolled in our studies on planetary health, on One Health. So the last thing I leave you with is that conservation is public health. All too often we see nature pitted against human health, but in reality, the two are related to each other. You cannot have conservation of nature without securing human health, and we cannot have human health without nature being intact. And so I hope that we can start moving to a new worldview in which we view these two as two sides of the same coin. With that, I am done. I want to thank so many people, Research America first and foremost, the many people listed here. A special shout out to the Preventing Pandemics at the Source Coalition. And again, thank you all so much. I'm going to stop sharing my slides.
Oh, Neil, that was fantastic. I think you've made a really strong case about why this is a responsibility for everyone. And I really love that you recognize the role that civil society and health researchers can play in moving these issues forward. I think that you've done also an excellent job of underlying the case for investments in pandemic preparedness, prevention, and response. Particularly close to our hearts is that research and development focused to prevent future pandemics and to stop outbreaks closer to the source. Just a few questions that came to mind as you were talking. I think that you were so right to say, pandemics are a choice. Outbreaks are inevitable, but pandemics are a choice, and it's a choice that, has huge devastating consequences. Before I go to my first question, I just want to remind the audience that if you do have any questions that you would like to ask Neil, please put them in the chat or the Q&A box, and we will do our best to get to them. First, being is that we're based in the US, are there any specific regions or areas where there's a greater risk of spillover? And, how do we kind of increase surveillance there?
Yeah, interesting question, Ashley. And before I get to that, I wanted to dive a little bit deeper into your comment about pandemics being a choice, because I fully concur. And also, it's true that outbreaks aren't inevitable. That is a fact of life. We have pathogens being transmitted exclusively among humans. Animals will have their own pathogens that can then spill over. But what is also a choice is the current frequency of outbreaks. Yes, outbreaks are inevitable, but we can decrease the current frequency in which at which outbreaks are occurring by implementing some of the interventions that I have mentioned today. Now, on to the question about where should we be doing surveillance? Where are the high-risk areas? Many of the high-risk areas for infectious disease emergence occur in the tropics, and that's partly related to the high level of biodiversity across the tropics. And so where you have a lot of variety of life, you're also going to have a lot of microbial varieties, and some of those microbes can then infect us and cause outbreaks. But I want to be clear that biodiversity in and of itself is not the risk factor for outbreaks, epidemics, and pandemics. Rather, it is human activities that lead to the decrease in biodiversity, human activities that lead to destruction of rainforests, for example. And so, where do we need to be investing in surveillance? In many areas across the tropics, so that we can stop outbreaks where they stop them from growing into epidemics and pandemics. But at the same time, we've also found major outbreaks leading to epidemics and pandemics occurring in unexpected areas. For example, in 2009, with the emergence of a novel flu variant that occurred in Mexico, that might not have been one of the high priority areas that would have been highlighted on a map for infectious disease emergence. Or a few years later with the emergence of MERS, which is another coronavirus that came out of the Middle East. That again was not necessarily one of the biodiversity hotspots where infectious disease emergence would have been necessarily have been expected. So we have to have surveillance in a variety of different settings as well.
I think you're making some really fantastic points, Neil. I know that we're trying to drink the ocean from a cup, or whatever the phrase is, and kind of getting a higher level down to a little bit more detailed discussion. But I wanted to just point out and get your thoughts on kind of the international reaction to COVID, and how, beyond just the US, what are some of the gains on the global scale? Like, I'm thinking in particular that this year's big climate meeting, the COP, will have a day focused on health. Can you talk a little bit about that, or, are you involved in any of those?
You're absolutely right, Ashley. There are new policy initiatives happening at the highest levels of government and multilateral institutions to address pandemics. And you have heads of state of many different countries that are banding together to take action. So on the topic of the climate change conference of the parties that is taking place later this year, right? So that's also known as COP28. This is the first COP really where health is being featured so prominently, which is fantastic. But it's also stunning that it has taken 27 years for health to be featured so prominently in one of these climate change COPs. Climate change is probably the greatest threat to human health that we face today, according to the World Health Organization and the Lancet. So the fact that it's taken that long for health to be featured in the climate conversation is very concerning.
And why do you think that is? I mean, I know you and I have had challenges in kind of gaining the interest and acceptance from the global health, that is the global human health kind of sector, and that was a little bit of an upstream battle, if you will. But why do you think it is that it's so segmented, that there's so much vertical pillars within these when they're kind of interlinked?
You're absolutely right. There are these vertical pillars, and I think the problem is that we are in Western science, we are encouraged to dive deep into a problem. We have a very reductionistic approach, which has many benefits, right? Like to really understand a subject, but we are literally missing the forest for the trees. That deep dive is coming at the expense of our peripheral vision, and we are losing systems level thinking, and we're not able to think across these different silos. And that leads to, many of the solutions to these existential threats we face, whether it's climate or pandemics or whatever other major threat, the solutions actually lie in the interdisciplinary approach. And it's very hard for an interdisciplinary expert, so-called expert, to find opportunities. I'll just give my own personal experience. I am a medical doctor, worked at the CDC for nearly a decade doing outbreak response to zoonotic diseases. But my dream was to work doing exactly what I'm doing right now in a conservation organization, but it took me over a decade to land this job. So this is not just a problem on the health side, it's also a problem on the environmental side. We need to be working across boundaries, learning from each other, and bringing humility to the conversation. No one person, expertise, or institution has all of the tools to address the existential threats we face today, like my colleague Jonathan Jennings likes to say.
Mm-hmm. And I'm a big fan of Jonathan and Jonathan's work as well, kind of bringing that interdisciplinary approach to solving some of the biggest crises in Indonesia. So can we talk a little bit about, from your history and from your perspective, what are some of the key recommendations for policymakers? I know that we had legislation that was passed in the winter that was that pertained to global health security, but what are your key recommendations for policymakers for preventing future pandemics?
Number one, I would say is, if we're just looking at the U.S. government, is that a lot of our funding structures are focused on, again, those deep dive problems like a particular molecule or a protein or something like that. And again, that's absolutely important, but we're also not funding the ecological research. In many ways, pandemics are an ecological problem as much as they are a health problem. And so we have to change the type of research that we're funding so that other solutions beyond vaccines and medicines also get the necessary investigation so that we can implement better solutions. Just thinking beyond the United States, though, there are many policy processes taking place in multilateral organizations. So one example is the World Health Organization has a governing body known as the World Health Assembly. And that WHA is currently negotiating an agreement, perhaps at the level of a treaty, to overcome some of the shortcomings that we've seen during COVID in public health response. And so these negotiations are moving forward. Maybe by next year, we'll have an outcome. And it's critical that the final agreement have a very comprehensive approach to pandemics, because if it doesn't, we'll have another missed opportunity and we cannot afford to have more incomplete solutions. And so when I say complete approach, that's all the way from the ecological side, like I was talking about today, all the way down to the vaccine equity side, making sure that when we develop vaccines, that people around the world can receive them rather than people in more socioeconomically advantaged positions.
It's a really great point. I thank you for making it. That you mentioned the pandemic treaty or the pandemic accord. I know that the name is to be decided when it's finalized, which is supposed to be signed by March of 2024. So the clock is definitely ticking there. I wanted to get your thoughts on the new pandemic fund at the World Bank and how you see incorporating the One Health and planetary health approach, kind of what would be needed from this new funding body.
So one of the exciting bits of news over the last year or so is that the World Bank has a new fund for pandemics, right? It's shocking that such a fund didn't exist before, but this fund is basically designed to help countries around the world, particularly lower income countries, invest in pandemic prevention, preparedness, and response. Because remember, a health threat anywhere is a health threat everywhere. Even if you're just focused on national security of the United States, what is happening on the other side of the planet in terms of pathogen spillover and outbreaks matters to us here in the United States, because a pathogen within hours can be on a plane and land in New York City or Houston or wherever else in the United States. And so this World Bank Fund for pandemics has a lot of potential to enhance global health security for many countries. My concern, though, is that even though we've just been through this horrific past 3 years with millions of people dead and economies destroyed, people's lives destroyed, this pandemic fund is not getting sufficient donations for it to make the level of impact that it needs to have. Last I checked, maybe a few weeks ago, I believe it only had around $2 billion of donations from all countries, right? So that includes the United States, Europe, etc. Just $2 billion. And that is far below the level needed for sufficient investment in pandemic prevention and preparedness. Some estimates, for example, from McKinsey, are that to properly invest in prevention and preparedness for pandemics, we need investments of around $50 billion a year around the world. And again, that's a drop in the bucket compared to what we are going to spend in responding to the next outbreak, epidemic, or pandemic.
I mean, these are really, really great points, Neil, and you're right that the investment capital that's been raised so far by countries and philanthropic organizations, one civil society organization, it is very, very meager. We're facing the very real problem of the cycle of leaning into the cycle of panic and neglect. And I do think that there's a lot of not only fatigue from COVID, but fatigue around COVID. And I just wanted to get your thoughts on kind of where we should be beating the drum, and how advocates and how people whose lives and jobs and welfare have been impacted by COVID, where we can raise awareness. And that can be either at a specific event or through a certain technique.
I think we need an all of the above approach, right? Clearly, pandemics are an all of society problem. It's not just a public health sector issue. We know that the public health sector is chronically underfunded by governments, whether in the US or elsewhere. But it's also shocking to me how little we do invest in public health, given the scale of the threats that we face, again, in the last decade, from Ebola, Zika, COVID. And in many ways, and I hate to say this, but I think this is the truth, COVID is not the scariest pathogen out there. Even though millions of people have died and so many people have been infected by COVID, there are scarier things out there. And we are so quick to invest, at least in the United States, in our traditional defense budget, which is absolutely important. but for some reason, biological threats don't get the same level of investment or interest, perhaps because they don't capture our imagination in the same way, even though they are killing more people every year than many of the conventional weapons that we face. And so I think that we need to think of health not just as a humanitarian ethical issue, which is very important. And I imagine many people on this call are motivated by those reasons, but we also have to think of it from a more transactional security perspective, because it is a security issue.
Mm-hmm.
And the good news, though, is that when we invest in health and enhance health security, we're also actually genuinely helping individuals lead healthier, longer lives, right? So there's a win-win right here that we need to be capitalizing upon.
That's great. And that's a great point. I don't want to monopolize all of your time. So I'm going to ask my colleague, Jacqueline, to join us on screen. I know we have some questions from the audience. So go ahead and take it away, Jacqueline.
Great. Thank you, Ashley. And thank you, Neil. Such a fascinating presentation. You made a lot of really good points. So first question from the audience. What can individuals do to be healthier in the face of future pandemics?
This is a challenging question because I think we have seen over the last 3 years lapses from the governmental response to COVID in the United States and abroad. I think in many ways we found elected officials let us down. There was a lot of spread of misinformation that led people to make unhealthy choices. So on the one hand, I think we all have a responsibility to vote according to our conscience and make sure that elected officials get into office who are going to act ethically and in our best interests for the communities that they're serving. But that also means that given the lapses that we've seen from governments, we as individuals have to take actions to protect ourselves. And I don't like to push responsibility onto individuals, but we've seen that as a necessary tool for our own well-being over the last 3 years. So as individuals, I think we need to stay on top of the information that's out there, going to reputable sources of information, making sure that we are consuming information correctly, understanding it correctly, and not succumbing to the misinformation out there, right? And again, the forces of misinformation are so powerful, and I think we are all subject to them. You know, we face many existential threats today, from climate change, artificial intelligence, pandemics, nuclear war. But for me, the biggest threat that we face to humanity is the spread of misinformation. And that is an area that we need public health and other health researchers and many different experts getting into so that we have better tools to combat that misinformation.
Great answer. Thank you, Neil. Next question. Great overview presentation. What are some of the best pandemic prevention activities that you see which are ongoing?
I'll give 2 examples of pandemic prevention activities that really strike me as amazing. You know, one of them is from a colleague, Raina Plowright, and her colleagues, who have collected decades of data in Australia that have shown how what's happening to forests in Australia is leading to the emergence of Hendra virus. Basically, Hendra virus is a virus that fortunately has not been found to have any human-to-human transmission, but in the handful of people who have been infected, around 50% have died. And this is in a high-income country such as Australia, which just speaks to how devastating infection with this virus can be. But again, they've shown that when you have nature-based ecological countermeasures, you can prevent some of those spillovers of Hendra virus into horses that then goes on to spill over again into people, right? So that's one example of a very robust research study that has shown the importance of investing in nature for preventing outbreaks. Another example that I'd point to is work by Health in Harmony. And full disclosure, I am on the board of Health in Harmony, but their work has been peer reviewed and published in major journals, such as the Proceedings of the National Academy of the Science. And what the work by this organization has shown is that when you invest in healthcare of communities living in and around rainforests, you not only increase the health of those communities, such as dropping infant mortality by 2/3, but you also have reductions in deforestation. They found that when you invest in healthcare, you can have a 90% reduction in the number of families engaging in illegal deforestation. And so that is, again, a win-win situation. People and planet do not always need to be in conflict. There are many win-win scenarios. I think we are taught, and myself, I was taught that human well-being comes at the expense of nature, or nature comes at the expense of human well-being. And I think that is a false dichotomy that we need to move beyond.
Great, thank you. Very interesting. Next question. I used to work in biomedical research and intentionally moved to community engagement. I work from a local community lens. How do you think community engagement practitioners play a role in this type of conservation and preparation? And how does this work that can involve communication, socialization, and activation of different groups best connect to the global effort, which feels so necessary?
Community engagement is absolutely important in any of these conversations on public health. I was in West and Central Africa for the two biggest Ebola outbreaks ever. And I think there were a number of very important interventions informed by science for helping to address those two Ebola outbreaks. But at the end of the day, what led to success in containing these horrific situations was that community engagement, getting the trust of the communities that healthcare workers were serving so that safe burials could happen. Many people were dying of Ebola, and the customs in particularly in West Africa was that there would be a lot of interaction with people once they died. But that's when a person is most infectious, after death. The body is just teeming with virus, and a lot of transmission was happening. But of course, it's a devastating period in a family's experience, right? One of their loved ones has died. And so getting the trust of community so that safe burials can happen, so that family members can say goodbye to their loved one while also staying safe, was absolutely important. So community engagement is something that we must be prioritizing in all of this work. And I would just, again, underscore that health and harmony example that I just mentioned in Indonesian Borneo, that the investments in healthcare in Indonesian Borneo that this NGO supported was only possible because of community engagement, building trust with the community so that they understood that what was being done was really a form of listening to the solutions from the community and then implementing those solutions. And so, kudos to this person who put in that comment for making that switch, this community engagement type of work. And I think it's just key to our work on prevention, preparedness, and response.
Wonderful, thank you. I think we have time for about 2 more questions. How can we prevent the lack of sustainability and loss of interest in pandemic funding that we've seen from past large-scale outbreaks and capitalize on the efforts made from COVID-19?
Fantastic point that I think Ashley also mentioned before when she mentioned the cycles of panic and neglect. I'm a tuberculosis doctor here in New York City. In the 90s, tuberculosis was sadly rampant in New York City. There was a lot of investment. When the problem went away, that funding shrinked up, and that leads to, in some instances, resurgence of the infection. We saw that with Ebola after 2013. There was a lot of talk about the global health security agenda, but a few years later, a lot of that interest had dried up, and I think we're already seeing the same thing with COVID right now. And so I wish I had a very clear response. I am worried that despite what the entire world has been through over the last 3 years, COVID has become a political issue. I would have thought, perhaps I was naive, but I would have thought that we would have had more people coming together. But sadly, I feel like we're more polarized than ever before. So I don't have a very good answer for you, but I would go back to what I said before, that health is as much a humanitarian and ethical pursuit as it is a security pursuit. So we need to be investing in health with both of those lenses in mind.
Great, thank you. And last question. Sorry, it's to end on kind of a scary note, but important. I heard speculations about more deadly viruses in the future. How prepared should we be?
Yes, that is the reality, and it's not just speculation. Even before COVID happened, many experts, myself included, were saying that it's not a question of if the next pandemic is going to happen, but it's a question of when the next pandemic is going to happen. And the same thing going forward. In fact, some models suggest, given the ongoing pace of environmental destruction, the frequency of pandemics is only going to increase several fold in the coming decades. So we have to be investing in prevention and preparedness right now. And the next pathogen that emerges and causes the pandemic might have a higher fatality rate than we saw with COVID. It could be devastating, even more devastating than what we've experienced. And we can't shy away from these very scary, complicated discussions. We have to invest now. We can do better. We did not do a great job with COVID with millions dead, but we can do better going forward. But it takes the political will. We can't rely on individual action for this.
Agreed. Thank you. And thanks to the audience for your questions. I will now turn it over to Ashley.
Well, thanks, and thanks, Neil, and thank you to the audience for your thoughts and for participating. Before you go, hope you can join our next Alliance discussion this Thursday, June 8th at 11 a.m. as the debate over coverage for new Alzheimer's drugs continues. We've asked Dr. Jeffrey Cummings of the University of Nevada, Las Vegas to discuss the challenging path that led to these medicines, the state of science now, and hope for the future. Join us for this important conversation, and the link to register is in the chat. Thank you again, Neil. Thank you, everyone, for joining us today. We look forward to seeing you again soon, and please take care.
Thank you.
Thank you so much.